the Science Guy.
Bill Nye, the Science Guy.
Bill Nye the Science Guy.
Science rules.
Bill Nye the Science Guy.
What is hemophilia? Hemophilia is a rare blood disorder that is usually inherited. What this blood disorder is that it prevents the blood from clotting properly because it is not making enough protein, which is the clotting factor. What this means is that when our body gets a cut, the platelets, or let's call them friends, at the site of the cut sends a message to their friends, to then send a message to their friends, and so on until we have enough friends to plug up the cut, like in picture 4. You will see that the friends or platelets have congregated there to successfully plug it up and stop the bleeding. However, with hemophilia, this is not the case. Hemophilia is when the cut would not be able to clot properly, like in picture 3, because there is a problem with our friends. Our friends are lacking the proteins, which can consist of either factor 8, 9, or 11, and these are the proteins that we need for our friends. Protein factors in our friends are the ones that send the message to other friends but vary on the type of hemophilia. If we are lacking them, then we cannot receive as much help as we would like, which means we will be bleeding for longer than normal. The severity of hemophilia also varies on the person themselves and how many of these friends they have or do not have. This means that if we have more friends who lack protein, then we will be bleeding more when we have a cut, nosebleed, etc., or we can bleed for no reason at all within our joints, depending on the severity, which is called spontaneous bleeding. However, fewer of these proteins can also lead to or cause serious health problems.
Anatomy and physiology of hemophilia. How is a blood clot formed? When a person gets a cut, a blood clot will quickly form to stop the bleeding, scientifically known as coagulation cascade. Before blood can clot, as you learned in the previous slide, many different friends need to work together. If you've ever heard of the term teamwork makes the dream work, this is completely accurate when you're wanting your body to stop bleeding. There are 3 different paths these friends take, picking up other friends on the way to create a party. 2 friends start at either end of the city. One starts in the east end, known as the intrinsic pathway, and the other starts in the west end, known as the extrinsic pathway. They then meet with their third group of friends to party, known as the common pathway. Now let's take a look at the diagram to see how our friends travel. The intrinsic group focuses on blood and the extrinsic group focuses on tissue. No, not Kleenex. We're talking cells in the human body. However, if one of these friends is sick, the party cannot happen. With hemophilia, we will mainly be focusing within the intrinsic pathway. If you can follow along with the diagram on the slide, it walks you through the whole scientific process of forming a blood clot. When friend 8, known as factor 8, a protein in your blood, is sick, it causes blood to not be able to thicken or stabilize. This is an issue because for bleeding to stop, it needs to get thicker to plug the hole or cut in this instance. This is also true when it comes to friends 9 and 11, or scientifically known as factors 9 and factor 11, different proteins within your blood. Think of it like a sink and a running tap. If you leave the water running with no plug, the water just goes down the drain. When you put the plug in, the water is able to stop, causing no more water flow. In this case, the blood is the water and the clot is the plug. This is just a visual for you to understand the process. Now say we have a plug, but it has a couple holes. So the water is able to stop going down the drain as fast, but is still getting through. This is what happens when factor 8 or factor 9 or factor 11 are sick or non-existent. These friends put holes in the blood clotting process.
When speaking about hemophilia, we know that this occurs when a clotting factor is missing or levels of the clotting factor are low. There are different contributing reasons that cause people to have this disorder. According to the Mayo Clinic, there are 2 types of hemophilia, congenital and acquired. Congenital hemophilia means that the gene is located on the X chromosome at birth. With that being said, females have 2 X chromosomes, while males have an X and Y chromosome. Males are affected if they inherit the affected X chromosome. This, most times, is passed from mother to son through the mother's genes. Most women are carriers for the gene and don't show symptoms. The X chromosome contains many genes that aren't present on the Y chromosome. The way that females obtain this disorder, which is very rare, is both of the X chromosomes must be affected. When we are talking about hemophilia and it is not congenital, it is considered to be acquired. According to the Mayo Clinic, there are many different reasons that people can become a hemophiliac. There are reasons such as pregnancy and complications during pregnancy, autoimmune conditions, cancer, multiple sclerosis, and drug reactions.
Signs and symptoms of hemophilia varies on the individual and whether they are an infant, child, or an adult. Signs and symptoms consist of bleeding in the mouth and gums and bleeding that is hard to stop after losing a tooth, bleeding after receiving vaccinations, blood in stool or urine. Blood in stool can also mean that there is bleeding in the digestive system, which also includes black stool or blood in vomit. Other signs and symptoms include bleeding in the joints. This can consist of a bubbly feeling, cause tenderness, pain, stiffness, swelling, or tightness in the joints. You may also have trouble using the joint. The most common joints consist of elbows, knees, and ankles. Bleeding in the skin, bruising, muscle, or soft tissue can cause a hematoma, which is a buildup of blood in the area. Bleeding in the muscle can also cause warmth, pain, swelling, and bruising. Another sign and symptom is nosebleeds that are difficult to stop and are frequent. And lastly, bleeding in the brain, which can cause headaches, sleepiness, vomiting, or seizures. In infants, bleeding in the brain can happen after having a difficult delivery.
Now that we know the signs and symptoms and the causes for hemophilia, let us talk about the diagnosis. Diagnosis can be made before birth and after birth. Before birth, hemophilia A can be diagnosed if a baby is born in a family that has a history of hemophilia, whose mother is a carrier, or if the baby has shown symptoms of bleeding. 2 prenatal testings can be conducted using the umbilical cord blood. One is the amniocentesis, and second is the chorionic villus sampling test. Hemophilia B is diagnosed at a later stage. Diagnosis after birth is conducted through screening tests or clotting factor tests. There are various types of screening tests. The CBC, or the complete blood count test, is the most common form of testing. This measures the amount of hemoglobin, red blood cells, white blood cells, and the platelets in the blood. The other 3 tests measure different clotting factors and its ability to clot blood. Activated partial thromboplastin time test measures clotting factors 8, 9, 11, and 12. Prothrombin time test measures clotting factors 1, 5, 2, 7, and 10. And the fibrinogen test measures clotting factor 1.
There are several different types of treatments for hemophilia. The best way to treat hemophilia is by what is called factor replacement therapy. This works by replacing the missing blood clotting factors so that blood can clot normally. There are also non-factor replacement therapies. These therapies work by delivering medications that aid blood clotting by mimicking natural clotting proteins, increasing the levels of clotting factors, or medications that prevent blood clots from breaking down. In individuals with rare acquired forms of hemophilia caused by an autoimmune reaction, inhibitors can develop that prevent clotting factors from working properly. Bypassing agents can be given to these patients as they promote blood clotting through different mechanisms that don't depend on missing proteins. Lastly, gene therapies are a novel form of therapy which work by delivering a normal version of gene to cells, usually by using viral vectors. This lets the body produce clotting factors on its own again. Click on the link provided to find the treatment center located nearest to you.
Factor treatment temporarily replaces the missing factor and becomes activated and controlled by the body's natural blood clotting process. Infused factor, along with the factors naturally existing in the blood, work together to produce the amount of thrombin your body needs to stop a bleed when and where it occurs. Once a bleed is controlled, factors become inactivated and unused factor is eliminated from the blood, an important step that prevents thrombosis or overclotting. The body's natural clotting process is highly complex. Factor works within this balance system to help keep you protected.
To learn more about hemophilia, please visit the Centers for Disease Control and Prevention website. A special thank you to everyone who contributed